The two main characteristics of CIPA, also known as hereditary sensory and autonomic neuropathy type 4, are the inability to feel pain and temperature, as well as a decreased or absent sweating. The symptoms first appear at birth or infancy. The inability to feel pain or temperature often leads to repeated unintentional injuries. In babies, the biting of the lips, tongues, or fingers may lead to amputation of the affected area. People with CIPA often heal slowly from skin and bone injuries. Repeated trauma can lead to osteomyelitis, in which bone and tissues of the surrounding joints are destroyed. They suffer from high fevers, which is known as hyperpyrexia, and seizures caused by high temperature, known as febrile seizures. Some characteristic features of CIPA include leathery skin, known as lichenification, on the palms of their hands or misshapen fingernails or toenails. This also includes patches on their scalp where the hair does not grow, called hypotrichosis, and they might suffer from intellectual disability as well. Weak muscle tone, known as hypotonia when they are younger, but they grow stronger with age, is also a characteristic feature. Diagnosing of CIPA includes profound sensory loss affecting pain and temperature perception, lack of response to painful stimuli, including pinprick, vigorous pressure on the Achilles tendons, testes, and stylomastoid processes and superior orbital rim, a decreased perception of hot and cold through a history of unrecognized responses to burns. Another way to test is the absence of the axon flare response after intradermal histamine phosphate injection. After the intradermal injection of 0.1 milliliters histamine phosphate, usually an initial local area of erythema appears, followed within 3 to 5 minutes by a central wheal surrounded by a diffuse flare with irregular borders. In HSAN, the wheal is surrounded by a sharply circumscribed border. Absence of sweating can be identified by the following tests: quantitative subtomotor axon reflex test, as well as sympathetic skin response. Through histopathology, a skin biopsy can be done. This is the absence of eccrine sweat gland innervation and small nerve fibers in the epidermis. A sural nerve biopsy, which is the reduced numbers of myelinated small diameter fibers and unmyelinated small diameter fibers associated with normal numbers of large diameter fibers. Molecular genetic testing. The gene NTRK1 is the only gene in which mutation is known to cause HSAN4. Clinical testing. This includes sequence analysis, deletion or duplication analysis, as well as linkage analysis.
At the moment, there is no known cure for this disease, so treatment is focused on managing it in various ways to prevent injuries or infections. Antibiotics help to treat the infection in the mouth or skin, and naloxone is a chemical that acts within the nervous system of the body, blocking the nervous system from causing the inactions that occur within the group of cells that receive messages to initiate the sensation of pain, heat, or cold. Behavioral therapy is used to help improve communication and social skills, strengthen learning abilities, and adaptive behaviors. It's most successful if it's started early in the patient's life. Patients who suffer from intellectual disabilities must have an education tailored to their specific strengths and weaknesses. According to the government, it must be free, the progress must be documented, each individual student has an individualized education plan, but it's also recommended that they be in the same class as other disabled kids, although some go to regular schools while others go to specialized schools. Another part of treatment is occupational therapy, which is used to help the child learn how to perform basic everyday tasks. The prognosis for most patients living with CIPA is that they will not live past the age of 3. If it does happen, they will probably not live past the age of 25 and will spend most of their lives being wheelchair bound.